I feel my job as a surgeon is to educate the patient on what their options are. And so I would tell a patient who's having knee pain but doesn't really want to proceed with surgery, I would talk to them about their options, surgical and non-surgical. Patients ask me this all the time, when am I ready to have my knee replaced? I always tell them, you'll know when you're ready because you'll just know. And patients typically do that. They've had injections, they've had therapy, they've tried the pills, and at some point they just say, I'm done with this whole thing, just fix my knee and I want to be done and over with this. And so I would say it's important that a patient decides for themselves to proceed with surgery, because then they have ownership of the surgery itself and the recovery process. They're invested in the surgery, and it's not like, well, the surgeon talked me into it and now it's, if they are invested in it, they will be invested then in the recovery process, therapy, pain management. They'll do what I ask them to do as far as protocols and recovery protocols. And then it's more of a team effort, kind of a shared decision making rather than the surgeon said I need to do this and so I did it.